You are asked to take a urine specimen from a patient's indwelling catheter. What should you do immediately before you expel the urine sample into the sterile container? A. Clamp the catheter. B. Remove the clamp. C. Place the lid on the sterile container. D. Label the sterile container. The correct answer is B. Remove the clamp. Immediately before you expel the urine sample into the sterile container, you must remove the clamp that you had previously placed on the catheter. You would not place the lid on the sterile container, or label it, until the urine sample was placed inside. You also need to remember to include the sample amount taken when recording the patient's total urine output. Category: Basic nursing care provided by the nurse aide. As a nursing assistant, what is your first priority when a fire occurs at the facility? A. Immediately remove all patients located in the fire zone. B. Immediately activate the facility's fire alarm. C. Immediately extinguish the fire. D. Immediately close all doors to contain the fire. The correct answer is A. Immediately remove all patients located in the fire zone. A nursing assistant's highest priority is the care and the protection of their patients. Therefore, their first priority would be to immediately remove all patients located in the fire zone. Many patients are not capable of caring for themselves, so it is important that they are immediately removed from harm. Nursing assistants should remember the RACE system: remove, activate, contain, and extinguish when a fire occurs. Category: Promotion of safety. Which of the following options best describes why isolation procedures are implemented? A. To observe patients. B. To provide patients with exercise. C. To transfer patients. D. To control infection. The correct answer is D. To control infection. Isolation procedures are implemented in order to control infection. Other items that help the spread of infection are proper hand washing, proper handling of contaminated items, and the instant reporting of potential environmental issues. It is the responsibility of the nursing assistant, along with other staff members, to adhere to the facility's standard of care. Category: Role of the nurse aide. The patient would not be quiet during dinner, so the nurse isolated her in the closet for 2 hours. Which of the following options best identifies this action? A. Involuntary seclusion. B. False imprisonment. C. Invasion of privacy. D. Neglect. The correct answer is A. Involuntary seclusion. Involuntary seclusion is the act of punishing a patient by isolating him or her from the other patients. In this question, the patient was isolated in a closet as a form of punishment for talking too much at dinner. False imprisonment is when a patient is restrained from moving freely about against his or her wishes. Invasion of privacy occurs when the nurse fails to keep the patient's matters confidential, or exposes the patient's body while performing care. Neglect is an act that results in patient harm due to the nurse ignoring his or her needs. Category: Role of the nurse aide. Which of the following chronic diseases is not responsible for affecting the thinking and reasoning processes of elders? A. Alzheimer's disease. B. Stroke. C. Arteriosclerosis. D. Tuberculosis. The correct answer is D. Tuberculosis. Tuberculosis is not a chronic disease that is responsible for affecting the thinking and reasoning processes of elders. Tuberculosis is a communicable disease, a contagious disease, not a chronic disease, only affects one person. Tuberculosis is a bacterium that affects a person's lungs and immunity system, but it is not known for affecting one's thinking and reasoning processes. A stroke, arteriosclerosis, and Alzheimer's disease are all chronic diseases that have the potential to affect one's thinking and reasoning processes. Category: Promotion of safety. Which of the following options is not acceptable when changing a patient's linens? A. Folding the contaminated side of the linen inwards. B. Placing the contaminated linens inside of a plastic bag. C. Placing the linens on the floor while changing them. D. Changing the contaminated linens immediately. The correct answer is C. Placing the linens on the floor while changing them. It is not acceptable to place linens on the floor while changing them. In order to control infection, a patient's linens should never touch the floor. If clean linens should touch the floor, they should not be used until they are cleaned again. When changing a patient's contaminated linens, you should fold the contaminated side inward, place them in a plastic bag, and take them to the facility's designated area. Category: Promotion of safety. Which of the following statements is true in regards to reporting accidents or incidents? A. All accidents and incidents require an incident report to be completed. B. Only accidents or incidents that result in injury require an incident report to be completed. C. Only the person involved or injured is required to complete an incident report. D. Only patient-involved accidents or incidents require an incident report to be completed. The correct answer is A. All accidents and incidents require an incident report to be completed. All accidents and incidents require an incident report to be completed. It does not matter if the accident or incident resulted in an injury or if a patient was involved or not. All people involved, including the witnesses, are required to complete an incident report. Facilities use incident reports to improve their services to residents and to change their policies. Which of the following options best describes the role of a nursing assistant? A. Assessing and modifying the patient's nursing care. B. Providing the patient with direct personal care. C. Administering medications to the patient. D. Planning the patient's meals. The correct answer is B. Providing the patient with direct personal care. The role of a nursing assistant is best described as providing the patient with direct personal care. The nursing assistant has the most direct contact with a patient, as he or she is the one who performs the patient's personal care activities, observes the patient's vital signs, and communicates with the patient and his or her visitors. It is the role of the RN to assess and modify the patient's nursing care needs, and the LPN is responsible for administering medications to the patient. A dietitian should be the one who plans the patient's meals. Category: Role of the nurse aide. Which of the following options is the most effective safeguard used to manage infections in patients and workforce? A. Immunizations. B. TB screenings. C. Isolation. D. Hand washing. The correct answer is D. Hand washing. Hand washing is the most effective safeguard used to manage infections in patients and the workforce. A nursing assistant, along with the entire workforce, should wash their hands when they appear physically dirty, or when they become contaminated with body fluids or blood. In order to properly wash your hands, you should scrub them for 30 seconds using hot water and soap. Category: Promotion of safety. If a patient wakes up confused or delirious, this is a sign that indicates A. The patient is in a great deal of pain. B. The patient is receiving too much sleep during the day. C. The patient's sugar levels are not in line. D. The patient is not getting enough oxygen to the brain. The correct answer is D. The patient is not getting enough oxygen to the brain. If a patient wakes up confused or delirious, this is a sign that indicates the patient is not getting enough oxygen to the brain. When the patient's brain does not receive enough oxygen, the patient becomes confused. As a nursing assistant, it is your job to report any changes in the patient's consciousness. Category: Promotion of function and health of residents. What should a nursing assistant do when he or she notices warning signs that indicate the patient may be developing a bedsore? A. Immediately report the warning signs to the patient's assigned nurse. B. Administer the medication that is used for healing bedsores. C. Monitor the warning signs to see if they get worse. D. Ignore the warning signs until a bedsore actually develops. The correct answer is A. Immediately report the warning signs to the patient's assigned nurse. The nursing assistant should immediately report the warning signs to the patient's assigned nurse. It is the legal and ethical responsibility of a nursing assistant to report all patient abnormalities to the patient's nurse as soon as they are identified. Therefore, the nursing assistant should not continue to monitor the patient's warning signs or ignore the warning signs completely. A nursing assistant is not certified to prescribe medication or to treat patients. Category: Role of the nurse aide. You are visiting Mr. Jones as he eats his lunch. While chewing a bite of his food, you notice that he grabs his throat and begins choking. As a nursing assistant, what is the first thing you should do? A. Apply Mr. Jones' oxygen mask. B. Perform the Heimlich maneuver. C. Call Mr. Jones' nurse for help. D. Perform rescue breathing. The correct answer is B. Perform the Heimlich maneuver. When a patient is choking, time is of the essence, therefore, the first thing you should do is perform the Heimlich maneuver. If you are performing the Heimlich maneuver and the patient stops breathing, you should then call for help and start performing rescue breathing until help arrives. If the patient is in need of oxygen, the nurse will have to administer it, as oxygen is a drug and a licensed nurse must administer it. Category: Specific care provided for residents with changes in health. Which of the following options identifies the appropriate method for securing a urinary drainage bag? A. Secure the drainage bag to the bedside rail. B. Secure the drainage bag to the patient's forestand. C. Secure the drainage bag to the bed frame. D. Secure the drainage bag to the patient's overbed table. The correct answer is C. Secure the drainage bag to the bed frame. The appropriate method for securing a urinary drainage bag is to secure it to the patient's bed frame. You should always avoid securing a urinary drainage bag to a movable object, i.e. side rail, forestand, or overbed table. Category: Basic nursing care provided by the nurse aide. Which of the following items is not information that is recorded on the facility form after taking a patient's radial or apical pulse? A. Rate. B. Strength. C. Depth. D. Rhythm. The correct answer is C. Depth. After taking a patient's radial or apical pulse, you must record the patient's pulse rate, strength, and rhythm on the facility form. After measuring a patient's respirations, you must record the patient's respiratory effort, depth, and rate on the facility form. After measuring a patient's blood pressure, you must record the measurement on the facility form. Category: Basic nursing care provided by the nurse aide. Which of the following terminology definitions is false? A. Delirious is when an individual is in a state of confusion. B. Tachycardia is when an individual has an increased pulse. C. Hypertension is when an individual has low blood pressure. D. Avoid is when an individual urinates. The correct answer is C. Hypertension is when an individual has low blood pressure. Hypertension is not when an individual has low blood pressure, it is when an individual has high blood pressure. Hypotension is when an individual has low blood pressure. All of the other terminology definitions are correct. Category: Promotion of function and health of residents. Which of the following methods is the appropriate method for removing a mask? A. Untie the bottom tie first, then the top tie. B. Do not untie the mask, just slip the ties over your ears. C. Grasp the front of the mask and slowly lift it over your head. D. Untie the top tie first, then the bottom tie. The correct answer is A. Untie the bottom tie first, then the top tie. When removing a mask, you should untie the bottom tie first, then the top tie. You should only grasp the mask's ties, never the front of the mask. After removing the mask, be sure to dispose of the mask in a covered trash can. Category: Basic nursing care provided by the nurse aide. Which of the following locations is the appropriate location to store a patient's bedpan? A. On the patient's overbed table. B. Under the patient's bed on the floor. C. On top of the patient's bedside table. D. In the bottom drawer of the patient's bedside table. The correct answer is D. In the bottom drawer of the patient's bedside table. You should store the patient's bedpan in the bottom drawer of his or her bedside table. You should never place the bedpan on the floor, as it will contaminate the bedpan. You should not place the bedpan on the patient's overbed table or bedside table, as the bedpan will contaminate the tables. Category: Basic nursing care provided by the nurse aide. The nurse punched out the patient's medications and placed them in the trash without giving them to the patient. After 2 days of not receiving his medications, the patient was in severe pain. Which of the following options best identifies this action? A. Negligence. B. Neglect. C. Abuse. D. Battery. The correct answer is A. Negligence. Negligence is an act that results in patient harm due to the nurse omitting care to the patient or incorrectly providing care to the patient. In this question, the patient was in unnecessary pain because the nurse was negligent by not giving the patient his medications. Neglect is an act that results in patient harm due to the nurse ignoring his or her needs. Abuse is when the patient suffers from physical or mental harm that was either committed or threatened. Battery is when a patient is subjected to unlawful personal violence. Category: Role of the nurse aide. Needles are often used in the healthcare of patients. If you should find a needle when changing a patient's bed sheets, what should you do with it? A. Place it on the patient's bedside table. B. Place it with the patient's other medications. C. Place it in the sharps container. D. Place it in the closest trash can. The correct answer is C. Place it in the sharps container. A needle, or any other sharp object, should always be placed in the sharps container. By placing the needle in the sharps container, you are ensuring that an accidental needle stick will not occur. If a needle was placed in a trash can, individuals who handle the trash have the potential to be punctured by it. Patients should not have access to needles or other sharp objects. Category: Promotion of safety. Which of the following personal qualities is a nursing assistant demonstrating when he or she accepts a new assignment without complaint? A. Being considerate. B. Flexibility. C. Self-responsibility. D. Accountability. The correct answer is B. Flexibility. Flexibility is the personal quality in which a nursing assistant would accept a new assignment without complaint. As a nursing assistant, you will most likely be reassigned to a new patient group or unit during your career, and you will need to be flexible and accept the new disruption in your work routine. Being considerate is the act of being thoughtful, kind, and caring towards patients and coworkers. Self-responsibility is the act showing responsibility for yourself by wearing the appropriate personal protective equipment, caring for your own personal health, keeping your workspace safe from hazards, and conserving energy by streamlining your work duties. Accountability is your ability to perform the job duties for which you have been trained and to bring up any concerns privately with your immediate supervisor. Which of the following is not an abnormal reaction to analgesia? A. Dyspnea. B. Diarrhea. C. Emotional distress. D. Sudden drop in blood pressure. The correct answer is B. Diarrhea. Diarrhea is not an abnormal reaction to analgesia. Analgesia is a medication given to reduce a patient's pain. If a patient should experience an adverse drug effect or an abnormal reaction to analgesia, the symptoms would include a sudden drop in blood pressure, a sudden drop in respirations, a rash, emotional distress, or dyspnea, rapid breathing. If one of your patients should show any of the previous symptoms, you should notify his or her nurse immediately. Category: Promotion of function and health of residents. One of your patients has recently started to refuse to participate in social activities and has been having trouble sleeping and eating. These are all signs that the patient: A. is antisocial. B. is in pain. C. is delirious. D. is dehydrated. The correct answer is B. is in pain. Some patients have a high tolerance of pain and others do not want to verbally express pain. However, there are signs that indicate a patient is in pain, such as refusing to participate in social activities, having trouble sleeping, and not having an appetite. Some patients are worried that if they complain about pain, that they will be labeled as complainer. Therefore, it is important that you always take a patient's report of pain seriously. Category: Promotion of function and health of residents. Which of the following options is a warning sign that a patient may have a fecal impaction? A. If the patient has a small, watery leakage of stool. B. If the patient expels a watery brown liquid. C. If the patient has blood in his or her urine. D. If the patient starts vomiting a black substance. The correct answer is A. If the patient has a small, watery leakage of stool. A warning sign that a patient may have a fecal impaction is if the patient has a small, watery leakage of stool. A fecal impaction is when a patient has hard stool that is trapped and cannot be pushed out of the large intestine and rectum. If the patient expels a watery brown liquid, he or she has diarrhea. Category: Promotion of function and health of residents. A resident with heart disease may experience health issues with atherosclerosis. Which of the following options best defines atherosclerosis? A. Narrowed arteries. B. Pain that occurs in the chest. C. Fats and calcium that accumulate inside the artery's lining. D. A heart attack. The correct answer is C. Fats and calcium that accumulate inside the artery's lining. Atherosclerosis is best defined as the fats and calcium that accumulate inside the artery's lining, and is also known as plaque. Arteriosclerotic is the medical term used to describe narrowed arteries. Angina is the medical term used to describe chest pain. Acute myocardial infarction, AMI, is the medical term used to describe a heart attack. Category: Specific care provided for residents with changes in health. Which of the following team members is responsible for working with the patient's therapist and dietitian to ensure that the patient is receiving the proper care? A. Nursing assistant. B. Licensed practical nurse. C. Registered nurse. D. Unlicensed assistive personnel. The correct answer is C. Registered nurse. The registered nurse, RN, is responsible for working with the patient's therapist and dietitian to ensure that the patient is receiving the proper care. The RN is the team member who is responsible for carrying out the physician's medical plan for the patient, as well as the patient's nursing care plan. The RN may also be responsible for the supervision of other RNs, along with the LPNs and CNAs. Category: Role of the nurse aide.